Welcome, everyone. Good morning, and thank you for joining PSHSA's Return to the Workplace virtual conference. My name is Seth Sobel, the Manager, Occupational Therapy. I am pleased to welcome you to Digitally Enabling Physical Safety, Diversio's COVID-19 Workplace Safety Audit with Laura McGee and Maddy Channen. Before we begin, I want to mention that there will be an opportunity to answer a few questions following the presentation. Please feel free to enter your questions in the chat box, and we will select some of them from there. So without further ado, I would like to introduce our feature speakers. First, we have Laura McGee. She is the founder and CEO of Diversio. Prior to Diversio, Laura was a consultant at McKinsey & Company in their public and social sector practice. She is a serial founder of social movements like Go Sponsor Her, Hack Inclusion, and Summit Leaders. She was named a top 25 women of influence in 2017 and currently serves as co-chair of Canada's expert panel on women entrepreneurs. Her board positions include ArcTurn Ventures, Global Citizen, University of Waterloo, and Ted Rogers School of Management. She is a David Rockefeller Fellow with the Trilateral Commission. With her is Maddy Channen, who is the head of product at Diversio. Prior to coming on board, Maddy spent 5 years in management consulting with McKinsey & Company, where she was an associate partner who focused on building digital businesses for banks globally. She then led strategy and M&A at AMIA and business-to-business loyalty software and services player, where she launched new products and helped close to 60 million bottom line gaps against the odds. She has a proven record of scaling digital organizations, developing commercial models and partnerships in business-to-business software, and bringing products to market. So without further ado, I would like to introduce Laura and Maddy.
Thanks, Seth. I hope everyone can hear me okay. I know I was having internet issues earlier. Real pleasure to be here. Thank you for having us. We're really excited to talk about our solution that we've developed to help organizations manage the new kind of post-COVID world and all of the compliance requirements that are suddenly foisted upon them. So I won't, I think we'd love for this session to be as interactive as possible in a digital environment. So I thought that we could start by sharing a little bit of background on our company. Then I'll turn it over to Maddy to take you through a bit of a product demo, and then finish up kind of circling back to our complementary diversity offering. I think it's worth noting that, the current political context, social context involves safety not only from a physical perspective, looking at, a global pandemic, but also from a mental health, inclusion, and belonging perspective. As employees, reflect on things like racial equality and all of that kind of good stuff. So I guess a little bit of background on Diversio. So founded the company a couple years ago with a mandate to help organizations become more inclusive through data and machine learning. And so what we do, typically kind of pre-COVID is we collect data on employee engagement and experience. We analyze that data using proprietary algorithms, and then we create really tactical action plans for organizations to implement to consistently improve that experience and ultimately create a safer and more inclusive workplace for employees. We do a lot of work, as you can imagine, given my background, with governments around the world. So at the federal level in Canada, provincial level and municipal, as well as internationally in Europe and Latin America. And so how we often work with those types of clients is by auditing large groups, large numbers of organizations, and then mining those audits for insights that the government or policymaker can use to drive improvements across the board. So that's, the starting point. So our platform is machine learning enabled, quite cutting edge, and really a sophisticated auditing platform that is combined with really tactical solutions. And so when the pandemic really took its hold in Canada, we sat back and we said, we think we've got a great opportunity to help organizations manage this new kind of inflow of concerns around mental and physical health and their employee safety and experience, we think we have an opportunity to adapt our platform to really focus on creating safe workplaces as economies reopen. So maybe with that in mind, I'll turn it over to Maddy to walk through how that platform really tactically operates. Thank you.
That's great. Thanks so much, Laura. So as Laura mentioned, I think part of our effort on helping businesses really comply and respond to new physical safety regimes came about from discussions that we had with clients. And I think we really found two problems that we've wanted to solve with our auditing platform. So the first one, I think, is as we've seen the economy start to restart, businesses across sectors are absolutely overwhelmed with new safety policies and procedures. And I think what we heard is people are having a really hard time keeping up, but also having a hard time knowing if they're doing all the things that they should be doing to keep their kind of employees, their stakeholders, and their communities safe. So that's really the first problem that we're trying to solve. The second one, I think, is a bit more of a data gap on the part of overseers. So think folks like governments or industry bodies. And there, I think one of the things that we noticed was governments are flying a little bit blind when it comes to making decisions around reopening and actually monitoring the compliance of new safety policies. And so it's really those two sides of the coin that have led us to deploy our existing technology solution and technology stack against the challenge of readiness to reopen. So I'm just going to share my screen, if you give me a second. Okay, that should be working. Okay, Laura, is this working?
Yes.
Okay, great, perfect. So I think, as I mentioned, I think the whole reopening process is posing a series of new safety challenges. And organizations are really grappling with this risk of non-compliance. And so our solution, I'd say it has really three elements that I'll take you through. But what it does effectively is help organizations audit their compliance with the latest and greatest guidelines. So we've been tracking across all sectors and across all regions how those guidelines are evolving. And we've been doing that in partnership with the School of Public Health and the University of Waterloo, so that we bring that additional layer of expertise around epidemiology and public health safety to this challenge. I'll maybe just talk through a little bit more how the solution works, and then we'll actually go into a live demo. So really, as I said, there's kind of two sides to the coin. So one side is for organizations. So our platform allows businesses to assess their safety through a very light touch, user-friendly digital survey. And it actually does a comprehensive scoring that provides tactical recommendations for the organization on how well they're complying with these safety practices.
Hey, Maddy, if I can jump in quickly, are you sharing your screen? I'm not seeing anything, but it might be me.
Do you have do you see a presentation?
We can see your screen.
Yeah, we can see it.
Okay, great.
Great.
Yeah. So there's really three elements to the solution. So I'll talk you through, and then we'll actually go into a little bit of a more kind of live demo. So the first part is our fully digital survey platform. And so what we've done is work in close partnership with the University of Waterloo to take all of the sector-specific physical safety guidelines related to COVID and create an interactive digital platform that helps organizations assess those. So I'd say that the key features of this are that it's taking what was once a static website with very dense content and converting that into something that's digital, it's mobile, it's mobile first, it's user-friendly, but it's also very granular, rich, sector-specific, and up-to-date. So we're taking all of the safety guidelines, not only from regional bodies like the PSHSA, but also from the best of the best in terms of global sources on public safety, including the World Health Organization, Center for Disease Control, and other provincial public health authorities. So once the user completes that survey, and I'll demo that one in a second, they receive a very granular scorecard. And so what we've developed in close partnership with Waterloo is a proprietary safety scorecard that actually gives the organization an assessment of how well they're doing on different categories. So you can see we've actually broken that down into categories and sub-metrics that really make it practical for someone to say, okay, not only do I know exactly where I have a gap in my policy, but I'm also getting targeted recommendations for what I need to do to meet the bar. Our platform also has a benchmarking capability, so you can see that a little bit here. So it really allows you to look at how your institution is doing on physical safety compliance relative to peers who look and feel quite like you. The last part of the solution that we're really, really excited about is the dashboard. And so I think this comes back to the challenge that I mentioned at the beginning of this discussion, where governments are missing a lot of the data. And so what we've done is we're collecting all of those safety responses and aggregating that so that you can have a bird's eye view of what kind of safety compliance looks like across a region. So I'm actually going to jump in just really quickly. I'm going to jump into a bit more of a live demo of the solution. Okay. Can you all still see my screen?
Yes.
Great. So this, as I mentioned, so this is our fully digital platform. It's our safety audit. So a couple things I'll highlight. So one is the solution is mobile responsive. And so no matter what kind of device you're working on, you can take you can kind of play around with So essentially what'll happen is the interface will really seamlessly adapt depending on your device. So here, if we go down and you're actually answering it on a phone, that is kind of fully flexible in terms of the tech stack to respond. As I mentioned, we've been working to bring all of the latest guidelines here, but I also want to highlight that it's a really, really intuitive and easy to use platform. And while we've done a comprehensive audit of all of the safety guidelines across sectors, we actually have a big jump start in education. So the rest of the demo that follows will be tailored towards that. So I won't go through the entire survey platform, but you can see really what we're trying to do is both assess safety compliance as well as educate the user on what to look out for. And so when the user goes through the entire survey, what they get at the end is that very granular scorecard around physical safety. So you can see we have quite a bit of richness in terms of what that looks like. And everything here that you see in the light blue boxes, those are actually personalized recommendations around ways to improve safety based on how the user has answered the survey. I think one feature that I'll highlight, which I think we think is really powerful, is our ability to launch the survey to different user groups. So imagine you're a principal assessing the safety of your school as it reopens. So you might have a set of policies and practices that you can measure in terms of what you're doing to adjust classroom schedules, et cetera. However, one of the things that you might really want to know is how well these new safety measures are actually being implemented on the ground. And so we also have a pulse survey capability that allows an administrator to get one kind of assessment, but groups like faculty, janitorial staff, educational assistants, they can get tailored pulse surveys that really allow them to answer whether or not they're seeing those practices go from kind of policy into action. I'd say the last thing I'll highlight, and I know we saw this quickly in the presentation, but is the dashboard. So you can imagine there's a real use case here for someone like a school board across Ontario to get a bird's eye view of how well different schools and different areas are doing on physical safety, so that you can use that data both to highlight, who is doing extremely well, but also to make sure there are no real risk areas or hotspots. So that's really the kind of core of the platform. So I might just kind of pause for a second and see if there are any questions from folks, or Laura, if there's anything that you would like to highlight.
No, I think I think now would probably be a good time to take questions on the auditing survey. I think very happy to walk through how we're using our core platform to improve mental health in this time, if that's interesting to the group. So I don't know, Seth, if maybe now is a good time to kind of take a spin through the session questions or how you normally run this.
Absolutely. So we got one question from Megan Stevenson asking if there is a cost for the survey.
Laura, do you want to talk through the pricing?
Yeah, so our typical pricing model really depends on the type of organization. So the kind of, as a software solution, it's all subscription based and tailored to the size of the organization. So we don't, the survey is part of that package, if that makes sense.
Laura, you cut out for one moment at the end.
Yep, so the survey is part of the pricing package, which we do price on a subscription basis.
So Megan, I think typically the model works on kind of per user. We price the whole solution kind of per user on the platform. Great.
Okay, great. Are there any other questions? It's the one question we got in the chat box so far. So Maddy and Laura, if there's nothing else to add, we could just give them a couple minutes, see if there's any questions that trickle in. Is there anything else you wanted to add? We got another one. We got another question from Megan. So what else can you do on the platform?
Megan, you're holding down the fort here. So Maddy, do you want to maybe walk through the kind of a bit more detail on the functionality of the auditing platform, and then it might be a good opportunity to speak to inclusion and mental health.
Yeah. So I think so Laura will take you through another use case that we have for our platform around helping organizations become more diverse and inclusive. I'd say as it relates to our COVID solution, there's really a couple features that I'll kind of highlight in terms of what you can do. So number one is that survey platform, that digital front end is really flexible. So we have the ability, I think we have provided, we have sector specific survey assessments on COVID related physical safety. However, it's a very flexible platform. And so, if an enterprise or an organization wanted to customize what is actually being surveyed, that's very much kind of possible with that front end of the platform. So I'd say number one, we have a recommendation on what good safety looks like that we've developed with Waterloo. However, we can customize and do that in a fully flexible way. I'd say the second thing on the front end of the platform that's worth highlighting is the multi-user ability. So we can target kind of one safety survey with a certain set of questions towards one audience and another one to another audience. So, for example, we're in discussions with a hotel industry body in Alberta, and they wanted to launch, one flavor of the survey for their cleaning staff, one for managerial staff, and then they had a whole different set of user groups. So our survey also has those multi-user and multi-reporting capabilities. I'd say, so that's kind of the front end and survey element. In terms of the reporting and dashboarding, I think on that front, we have a very, very granular ability to kind of take that data and then visualize it to provide actionable insights. And so I think what you saw in the demo that we went through was what that could look like in a really specific way targeted towards one sector, in this case, education. However, again, similar to the front end of our platform, our dashboarding platform is really flexible. And so if an organization were interested in seeing a certain kind of metric highlighted in that dashboard, we can absolutely do that as well.
Great. So maybe Maddy, I'll jump in there. So I think that one thing that we have observed, and of course it's in our wheelhouse, but you all may have noticed this as well, is that the COVID pandemic is impacting certain demographic groups at a disproportionate rate. And so, for example, we're seeing that businesses in predominantly Black neighborhoods, for example, are seeing greater rates of outbreak. Similarly, there's a lot of data showing that kind of both economically and in many cases from a health perspective, women are disproportionately affected. And so how this plays out in a business is it's likely that women and other minorities, ethnic and racial minorities, are facing kind of greater barriers when engaging at work. And so we're seeing that come through on our core platform analytics. So if it's helpful, I will share my screen and give you a sense of what our core dashboard looks like and how it's being used to kind of drive safe work for all demographics within an organization. But it should also give you a sense just of the kind of functionality that the kind of COVID safety dashboard has as well. So I'm going to share my screen now. Can everyone see a dashboard?
Yes.
Maybe Maddy?
Looks great.
Great. Okay. So to give you a sense for how our dashboarding capability works, as Maddy kind of went through the process, we typically start by deploying a survey to employees. And this applies both from an inclusion and mental health safety perspective, as well as a physical safety perspective. And so the idea is you kind of anonymously ask employees about their experience in the workplace. That data is then ingested into the platform and analyzed and used to create a customized, of course, fully secure dashboard. So in the case of diversity, what we look at is, of course, high-level demographics within your organization, which gives you a sense for kind of what groups might be more at risk. And then importantly, similar approach and process is a KPI or metric-based approach to what the experience is like on the ground. And so I think the most relevant KPI, for this particular conversation is on safe work environment. And so what we're starting to see among organizations with the onset of COVID is that certain types of employees are reporting significantly lower scores on if and how the workplace is being experienced. And so I won't, go into detail on this platform, but the idea is we really use data analytics and in many cases free text analysis to pull out the most important insights for HR managers and executives, and then importantly, tracking progress over time. And so again, won't get into detail here, but there's a number of tools that allow you to really deep dive on that scoring framework to understand across different metrics and different groups what the experience is like. Some capability to deep dive into different groups of individuals. So some of you may be thinking, listen, of course, physical safety and compliance is top of mind, but we also have, a racial crisis among our country right now. And so it's important for us to understand not only are they physically protected and safe at work, but are they mentally protected and safe at work? And so you may want to compare, for example, responses of women from different minority backgrounds.
Hey, Laura, there's a question in the chat that's how do we go beyond the audit to actually addressing deficiencies?
Yeah, so that's a great question. So from the COVID safety perspective, as Maddy mentioned, similar to our diversity tool, what we do is we have a repository of solutions. So those are, again, informed by global best practices, the latest research as identified by the University of Waterloo, as well as provincial guidelines. And what you saw in the earlier report is you get your score on how well you're doing across different KPIs, but you also get really tactical, granular solutions. So basically gaps in your strategy, again, updated with great frequency on the latest data in terms of what you should be doing to improve on that metric. Maddy, do you want to maybe give a quick example from your scorecard?
Yeah, that sounds good. Well, so I think in the case of kind of physical safety or physical distancing, if the user of the survey or the administrator goes through and says that 2 meters of distance is not being respected all the time, I think that would be a practical recommendation to say, okay, you can use markers on the floor to actually indicate and control traffic. So that's just kind of one anecdote, but we do go into very granular recommendations to help not only identify the gaps, but also address the gaps. Great. Laura, maybe should we discuss quickly how we go beyond in the kind of diversity platform, how we actually provide recommendations as well?
Yep, so let me share my screen again. So how it works from an inclusion and mental health perspective is, of course, you have your analytics, which is quite granular and allows you to track different demographic groups. But we also importantly have a recommendation engine. And I'll pause here for a moment because the technology stack is the same for both the physical safety and the mental health safety solutions. And so very high level, how we created our, we call it a recommendation engine. And that's where we identify the really tactical solutions that are required to improve safety at your workplace. So just to pause there for a moment, we developed the technology initially in partnership with the University of Toronto. And what we did from a safe work environment perspective is we scraped every program, policy, tool, solution, you name it, on the market worldwide, used to promote an inclusive and safe workplace at all kinds of different organizations. And so what we collected, this, of course, being our core tool, we began this effort about 2 years ago. It's ongoing. And what we have now is a database of over 1,000 solutions that are all classified and ranked on things like what sector is it used in, what type of company, what region is it most effective in, has the solution been proven out by academia, has it been demonstrated to have an impact. And so what we do is we have a set of matching algorithms that, given what your employees are telling you on the front end, will match you with the right tactical solutions to improve safe work and ultimately inclusion. And so what you see here, again, is tailored towards diversity, but the same technology stack applies from a physical safety perspective, is you get a ranked set of solutions with case studies, resources, et cetera, that is designed to promote inclusion, mental health, and safety in the workplace. And so you can, for example, add a recommended solution to your action plan and kind of track the progress of those solutions over time. Anita, great question. So how would you address the issue of survey fatigue in some organizations? So we get that a lot. I think the way that we typically overcome that issue, number one, is by keeping the survey very short and very user-friendly. So as you saw kind of Maddy going through the demo, it is a 2 to 3 minute pulse survey from a compliance perspective. And again, surveys are designed to be completed on any device. So it really is something that an employee could do quickly on, the way to work or stopping for their coffee, that sort of thing. I think the second thing is what we're developing and have kind of really robust capabilities on, on the diversity perspective is natural language processing capabilities. And so, for example, you could plug our tools into an employee messaging platform to pull out thematically feedback from employees on what some of the top issues are. So I think, it is a bit of an art and science trying to identify the right cadence. We do think that, especially from a physical safety perspective, the cadence of reporting daily or weekly, a 2-minute pulse survey, makes sense. But in the longer term, if that is an issue, we do have capabilities to plug into messaging platforms.
And keep those questions coming.
So we'll just give another, a few seconds, or we'll give a minute for questions to trickle in. If not, if there's anything else you want to add, you're welcome to at this point. Otherwise, we could leave it there.
Yeah, I think maybe just to wrap up, Seth, given kind of the folks on the call, if there's any sort of next steps or anyone requests kind of a more customized demo on either the COVID front or the mental health and inclusion front, definitely feel free to reach out to either Maddy or myself.
Yeah.
I think one thing that may be helpful is we've created a toolkit and a leadership training package that's really designed topically around how to help employees feel not only safe and trusting of their workplace from a physical safety perspective, but also from an inclusion and mental health perspective. So the idea being, how can you demonstrate consistently that you as a workplace are, taking the right steps to promote all the best practices from a kind of pandemic perspective, as well as acknowledging the need for mental supports in the context of a racial pandemic. So again, very happy to share some free toolkits that we've created on that front. Just reach out to either Maddy or myself.
Perfect. All right, Laura, Maddy, that was fantastic. So first off, thank you, Laura and Maddy, for sharing an overview of the platform Diversio, and thank you for leading a fantastic discussion of the solutions you've launched and the best practices for operating with the right information, making decisions with data, and tracking workforce impact. It was certainly informative to me. I'm sure a lot of other people benefited from this a lot.